Healthcare providers are pushing for more people to get vaccinated, especially those who are pregnant. The CDC says evidence shows the vaccine is safe and effective during pregnancy. Pregnancy and recently pregnant people are more likely to get severely ill from the virus if they don't get the shot. And if you get COVID while pregnant, you're at a higher risk of preterm birth, among other issues. Well, tonight, our Emily Longnecker spoke with a woman who got COVID just before the birth of her son. She says if the vaccine was available back then, she'd been the first in line.
Every time she looks at her nearly one-year-old son, Henry, Ashley Bridgwaters is thankful. Not just because her baby boy is healthy, but because his birth last November was one of the more uncertain times of Bridgwaters' life. A week before little Henry was born, Bridgwaters tested positive for COVID. She was 36 weeks pregnant.
It was very stressful to have to go in and deliver with COVID, just mentally not knowing what was going to happen to me.
The now mom of three knows all too well the complications that can develop when someone's pregnant and gets COVID. That's because she's an OB nurse herself and has seen what can happen.
Just complications after delivery, from extra bleeding to sometimes being away from their baby and separated if their baby requires additional assistance.
Other times, Bridgwaters says complications never factor in, but there's no telling which way it will go.
And they test positive with no signs or symptoms. They have no clue they have it. And then we have other women that have major complications with it.
Thankfully, Bridgwaters wasn't one of those.
I physically did great. I was fine. The mental part of it was very hard for me.
Bridgwaters says if there'd been a COVID vaccine available while she was pregnant, she would have gotten it.
I understand people, when you're pregnant, you're kind of a special population and you're worried about what goes in your body and affects your baby, but I would have been in line for that vaccine, yes.
It's an opinion shared by less than half of those who are pregnant in the United States. According to the CDC, only 31% are vaccinated, despite recommendations that it's the safest thing to do while pregnant.
I'm just a huge believer in risk reduction and harm reduction, and I just think the vaccine is a huge player in that. I think science is there for a reason.
That's why 3 months after having COVID, Bridgwaters got vaccinated herself.
And it's just hard to see pregnant women and postpartum women getting so sick from COVID when there is something that could help them.
This mom and nurse hopes more will follow suit and decide to get the COVID vaccine. She didn't have the choice. Now, though, she says others who are pregnant do.
I am so thankful I did okay, but I just think now that there's a vaccine and you can prevent yourself from dying and leaving your children and your family, I just think it's smart to look into and talk to, again, trusted medical professionals.